In 90% of the patients, a cause can be identified, and oftentimes it can be corrected such that some patients can move on to conceive spontaneously without the assistance of a fertility specialist or fertility technologies. The first most common cause of infertility relates to a female patient's age. So many women are deferring childbearing for good reasons. They have wonderful and meaningful professions, perhaps they haven't met a significant other, or perhaps they want to conceive on their own. But that said, unfortunately, the biology for us as women is not kind. For us, we're actually born with all of the eggs that we're ever going to have, and that number of eggs declines with time. So very often I'll see patients that have a lower egg count as assessed by some early blood draw assessments. And I really look at that as the gas pedal, or giving me an idea about how aggressive do we need to be to achieve this patient's goal of starting their family. Other patients of mine have endometriosis. This is a common condition where the uterine lining can actually grow outside of the uterus and implant on some of the organs in the pelvis, commonly bowel or bladder or the ovaries. It's very painful. It causes periods that are painful above and beyond just the typical daily cramps. Sometimes women even have to stay home and are unable to engage in social and work-related activities because the pain is so uncomfortable. So when a patient has endometriosis, sometimes they require surgery to assist them with conceiving. For other women, though, medical therapy can be very effective in helping their pain symptoms, but also maximizing their likelihood of conception, again with lesser invasive techniques. For some of my patients, they have severe endometriosis, and in those cases, oftentimes we have to turn to assisted reproductive techniques like in vitro fertilization. Another common cause of infertility is actually male factor fertility. The wonderful news is that many of our male patients have survived cancer and have grown into adulthood and achieved marriages. Unfortunately, early cancer survivors can have pretty impactful negative impact on their sperm parameters when they go to start their families and having low sperm counts. Some of our patients are smokers or perhaps are overweight, and these can also be impactful factors on causing low sperm counts, causing infertility in their patient.